Hey, everybody, welcome to today's talk on transgender experiences, understanding dysphoria. I'm Baxter John Marie Ferguson. You can call me BJ. I am a science and health journalist focused on LGBTQ plus experiences. I'm queer and trans person myself. This presentation was originally created for a talk I gave at the Oaxaca Lending Library here in the city of Oaxaca, where I live. And I'm really excited to be able to share it with y'all. When I put this presentation together a few months ago, I wasn't sure if I should include these images or not, but um, I came down on the side of yes. This first image on the left here was taken in 1921 in Weimar, Germany, which was one of the most supportive societies for trans people in modern history, perhaps. It was taken by Willy Romer at the Magnus Hirschfeld Institute for Sexual Science in Berlin, just outside the first international conference for sexual reform, where researchers and activists of sex and sexuality gathered to discuss. You might recognize the name of the Magnus Hirschfeld Institute from this photo on the right, which is a bit infamous at this point. This first photo here was taken the same year that Hitler became a leader of the Nazi Party. And the second photo was taken 12 years later after Nazi youth stormed the Institute, destroyed it, and removed all of the research, decades of research, into a local public square and set it all on fire. And when I look at these two images side by side, I can't help but wonder if the people on the left had any suspicions about what was coming, if they talked about Hitler's popularity, and perhaps most importantly, if anyone took them seriously about what was going on. So when I first made this presentation, the Lemkin Institute had just issued, I think, their first warning about the ongoing genocide of transgender people in the United States. They have been calling it early stages of genocide. They've now issued their third warning, and in my opinion, early stages is wildly underplaying where we are right now. This is also a slightly older map from Erin Reed's newsletter, Erin in the Morning, where she looks at state-side anti-trans legislation risk. And that risk has gotten significantly worse across the board since this presentation was created. Since November 2024, an estimated 400,000 transgender people in the United States have left their home state or country. Have left their home for another state or country. And this is an internal refugee crisis. As protections continue to fail, it's going to become an international refugee crisis, and I think that's something we all need to be thinking very seriously about. Which is why I'm doing the work that I'm doing. So let's talk about what we are and are not going to be doing today. So we're going to talk about some definitions. So we're working from the same language. I'm going to describe what gender dysphoria is, talk about gender versus sex, talk about diagnosing gender dysphoria. And then the meat of this presentation is going over the various different kinds of gender dysphoria that exist and how transition seeks to address dysphoria. After that, I'll talk a little bit about regret and detransition, and then I have a couple of little exercises and thought experiments. At the very end, I'll address some quick ideas about things folks can do. And then if we have time, I will stop and take some questions, though I will not be including that in the if you're watching this later. As to what we are not doing here, as again, I wrote this specifically for the talk in Oaxaca, but I'm not interested in discussing culturally specific genders like the Mushe peoples or Two-Spirit identity. I do not have the cultural position to speak with authority on those topics, so please don't ask questions about them. I'm really not interested in debating legislation like bathroom bans or sports bans, so we're not going to go there. And I am especially not going to be defending the validity of my gender or anyone else's. This is not a philosophy debate, all right? So when I talk about dysphoria, what do I mean? Dysphoria is the opposite of euphoria. Medically speaking, when someone uses the word dysphoria, they mean clinically significant distress. This comes from Greek, and there are many different types of dysphoria, even within a medical context. So, for example, premenstrual dysphoric disorder is basically PMS that is so bad that it is clinically significant. Rejection sensitive dysphoria is not necessarily recognized in the DSM-V, but for that, we're talking about usually people with certain neurodevelopmental disorders like ADHD or autism, and like experiencing pain from rejection that is so intense that it is, again, clinically significant. So we're going to talk a lot about this more later, but you might just start to notice if we are defining dysphoria as something clinically significant, that means there has to be a body, people, who have the authority to decide what is significant and what isn't. And we'll talk a bit later about some of the problems that happens. First, I'm going to talk about our definitions here, what I mean when I say certain words. So first, cis and trans. From chemistry, on the same side of, or across from, or having crossed, or on a different side of. So when I say cisgender, I mean someone whose gender is the same as that assigned to them at birth. And when I say transgender, I mean someone whose gender is different from the one assigned to them at birth. When I say assigned at birth, I'm talking about in the hospital room or wherever, where a person was born. If their birth certificate, the sex assigned at birth is what it says on a original birth certificate. Gender assigned at birth is what we're talking about when did the doctor say it's a boy or it's a girl, for example. So this is very one-on-one stuff, but a trans woman is generally speaking going to be someone who was assigned male at birth and who people assumed to be a boy, but who was not. And a trans man is someone who sex assigned at birth is female and who people assume to be a girl and who is not. As you might have noticed, this is all pretty binary, and The reality is a lot more complicated than that. Intersex people have traits in one way or another that are associated with different sexes. So they might have ambiguous genitalia, or they may have grown up as a girl into a woman only to discover that their chromosomes are XY, or the opposite. They may have chromosomal makeup that is different than XX or XY. There are lots of different things that can happen here. And non-binary people, we're talking about people who are neither men nor women, neither girls nor boys. I myself am a genderqueer person. All right. Now, you will often hear that gender and sex are different things. I do think that this can be true. I also think that in general, we live in a world that treats gender and sex as basically the same. Gender dysphoria can actually be about sex or gender or both things. And we'll get into how and why in a second. So, when I talk about gender, I am talking about something that is innate, something that can be fluid, and something that is largely cultural. This might be a little bit confusing to begin with, because how can something be both cultural and innate? Right? So when I say innate, you can take that to mean born this way, but it doesn't have to mean that. When I say innate, I mean it is inherent to one's understanding of the self, and that it is largely a neurobiological phenomenon. But when I say it's cultural, I also mean that it is related to how we construct the idea of gender amongst ourselves socially. So a person only understands their gender within a social construct, what gender means to us as a society or a culture. But that understanding is inherent to who a person is. And when I say fluid, I mean something can change across time, but it cannot be induced or directed to change on purpose. Conversion therapy doesn't. All right. Now, when I talk about sex, a lot of people assume I mean male or female, very simple, very straightforward, and immutable. Can't be changed. But I'm actually talking about something that is basically the opposite of that in every regard. Sex is incredibly complex. We have all these different aspects that impact sex: chromosomes, genes, hormones, internal and external sex organs, and secondary sex characteristics. All these different things impact how a person's sex is read by others, and also how it shows up in important ways, like how one measures certain health markers, for example. And that's what we have here. Sex is based on karyotype, morphology, and endocrinology. So this is what I mean when I say sex is complex. It can show up in all different ways. It can be impacted by all kinds of different things. Now, when I say sex is mutable, what do I mean? I mean that sex can be changed. You generally can't change your own chromosomes, obviously, but you can change the hormones that your body uses to replicate itself. Hormones absolutely change the majority of secondary sex characteristics. There are some sex characteristics that can only be changed in one direction. For example, if you grow breasts during puberty, you cannot use hormones to ungrow them. If your facial hair becomes thick and grows quickly in certain places, like on your face or your chest during puberty, you can't ungrow that hair with hormones. But hormones can change uh, the quality of the hair. It can get maybe a little bit thinner, or it can change the shape of breasts. This is why going through the wrong puberty can be so harmful. If puberty is prevented with blockers and then induced using the right hormones, then a trans person can in many ways develop secondary sex characteristics along the right pathway in a way that doesn't need to be undone with, say, laser hair removal or top surgery. Another interesting thing is that hormones can change how your genes are expressed. And finally, hormones can have an impact on the sex organs. So uh, it can change the ascent of external organs. It can change the sensation and also the function in many ways. And of course, surgery can also change internal and external organs. All right, so if someone has clinically significant distress resulting from an incongruence between one's gender and one's assigned gender or sex, and or one's primary and or secondary sex characteristics, that is diagnosably gender dysphoria. So now we get to that question: who gets to decide how much distress is clinically significant? Well, the WPATH has their own uh, framework that generally suggests that if a trans person says that they have significant distress, we can believe them. It says that they want to change their sex characteristics, we can believe. The DSM-V uses a certain set of criteria that looks at the desire to change one's sex characteristics or to be another gender or be treated as another gender, or just a strong conviction that they are another gender. So the primary resource I used for the section of this presentation is the Gender Dysphoria Bible, which I chose for a number of reasons. First off, it is community created and supported. The creator Jocelyn Badgley released it under an open source Creative Commons license. And Jocelyn is a transgender woman who writes a lot about her own experiences as well. And this specific website, the Gender Dysphoria Bible, is probably the most frequently recommended source that I see out in the wild. Uh, Probably thousands of, like many thousands of transgender people have come to better understand themselves and their experience of dysphoria through this website. Before we get into this, I want to remind people that dysphoria is not the only framework through which we can understand being trans. So here I spoke about the incongruence between one's gender and the one assigned to them at birth. And in, I think especially in Europe, a lot of systems look at incongruence as the primary diagnostic criteria or the primary factor by which one can receive hormones or blockers or surgical care or other types of gender affirming changes. Um, so rather than putting in place a gatekeeper who has to decide whether or not this incongruence causes enough distress to warrant treatment, an incongruence-based model just says if your gender is not the one that you were assigned and you want to make changes to your body because of that, welcome to transition. So, in other words, dysphoria, there's often an argument about whether or not a trans person needs to have dysphoria in order to be trans, or even in order to access gender affirming care. I'm not a trans medicalist. I do not believe that medical intervention in particular is necessary to access care. I do not believe that a trans person needs to be able to identify specific types of dysphoria in order to be trans. I do think that more trans people experience dysphoria than realize it because there's more than just physical dysphoria. And we're going to get into that right now. So, physical dysphoria is the type of dysphoria that gets the most uh, coverage. The one most people are familiar with, and it's associated with this narrative of being born in the wrong body. Though, of course, not everyone who experiences physical dysphoria characterizes their experience that way. I saw someone on Reddit say, when talking about physical dysphoria, imagine if looking in the mirror had a wrong answer. I thought that was an interesting way to put it. So physical dysphoria is discomfort over specifically over the shape or appearance or sensation of one's own body. And one way that this shows up is something that is akin to phantom limb, which I find supremely interesting. There's also another similar syndrome in people who are born without certain body parts, but still have physical sensation for that body part. And according to this study here, about half of trans people experience this. So this study talked to just under 1,500 trans people. And yeah, just under half of the people surveyed in this study had some experience of what is described here as trans phantoms. So a physical sensation from a sexed body part that the person either did not have at all or wasn't born with and didn't have the nerves to physically connect to. And this study here was a bit of a corollary to that. This study specifically was on transmasculine people and showed that the people studied had a muted sensory response to their chest, specifically, the chest that they developed in a female estrogenizing puberty. I find this fascinating because I experienced this. And I remember when I first started talking about it, I was worried people would think I was not in my right mind because I didn't realize other people felt this way. But it is incredibly common. So I had the physical sensation of the chest that I have now underneath the chest that I developed during puberty, first puberty. Um, the question about why or how this happens is uh, not, we don't really have a great or perfect answer, but it is suspected that the neurological body and the brain develop like a map of how the perceptive mind, the mind that like sees and understands the body in physical space, that this like has a map of what the expected body is. And it is because this happens after sex determination happens in a developing fetus. Sex determination typically between 5 and 11 weeks, and the brain map between 14 and 24 weeks. And it's suspected that something, whether it was some sort of hormonal influence from the pregnancy or some other kind of genetic uh, predisposition, something impacts the brain map so that it doesn't develop in line with sex development. It's all very theoretical. All right. So I would argue that biochemical dysphoria is a type of physical dysphoria, specifically physical dysphoria caused by hormonal incongruence. So not just as in like because I went through an estrogenic puberty, I developed breasts and my body shape developed in a certain way, but like the physical presence of estrogen in the body on a daily basis. Um, this type of dysphoria is associated with a number of mental health uh, symptoms. So, trans brain fog is probably the most commonly reported, like anecdotal symptom, um, which is just sort of like the brain not being able to function optimally. And I definitely had this as a result of my physical dysphoria. Just like seeing and feeling these incongruent sensations around my chest all the time made it really hard to think about anything else. That was just like lightning storm all the time. Um, Biochemical dysphoria is also associated with depersonalization and derealization. So you can think of depersonalization as like mm, feeling like the body isn't my body isn't mine and doesn't belong to me. And derealization is the feeling like the world around me isn't real. So it's sort of like a matrix allegory type situation. Because hormones fluctuate throughout a person's day or month or life, hormonal dysphoria can also fluctuate. It can be cyclical, or even it can respond to external factors. So, for example, a body that produces testosterone and sperm is likely to respond to attraction to another person with an increase in testosterone. And so you can imagine how distressing it might be when every time you are attracted to another person, your body produces a hormone that makes you feel less like a human being, right? Okay. So Social dysphoria is, I think, a type of dysphoria that is wildly unrecognized. I have heard a lot of people say they do not have dysphoria, but then experience real mental health effects or social effects from being misgendered. For example, um, if you experience extreme discomfort or distress from being misgendered, that is social dysphoria, at least in part. If you experience physical dysphoria, then being misgendered can also like remind you of your physical dysphoria, right? But you don't have to experience physical dysphoria in order to have social dysphoria. And social dysphoria is all about what gender other people perceive or believe me to be. And that is highly cultural. Um, so, for example, I am a Canadian, white Canadian person. I live in Mexico. Mexican people are significantly more likely to gender me as a man, and gringos are still more likely to gender me as female. Now, I don't have a good answer for why that happens. I think there's a lot of questions about how people perceive femininity and masculinity differently, how people might do a risk assessment around what happens if I gender someone incorrectly. Um, but either way, it's definitely a cultural phenomenon, and this has been confirmed for me by other transmasculine people who I know. Yeah, not just transmasculine people, transmasculines as well as some gender non-conforming women. That Mexican people are just way more likely to gender them as men. Now, I was talking about that risk assessment around gendering someone correctly. And there's a real reason to think about that as important, because correctly gendering someone is highly protective of a person's mental health and very pro-social. We know that uh, misgendering causes significant minority stress, and that correct gendering and naming, especially among trans youth, is highly correlated with a reduction in depression, suicidal ideation, and suicidal behavior. Now, this is interesting to me because we live in a world where being seen as cisgender is seen as the like normal and right way to be a binary gender. For many people, being perceived as cisgender might not just be a matter of safety, though it is often a matter of safety, but also a matter of treating social dysphoria. A transgender man, for example, might feel like the only way that people around him will see him as a real man is if those people do not know that he is transgender. In other words, those people presume him to be cisgender. But on the other hand, for many people who are not men or women, boys or girls, social dysphoria around not being seen as our true gender can often be at odds with the need for safety and to be presumed to be cis. So, for example, if I want someone to see me as genderqueer, they inherently have to know that I am not a cisgender person, right? There's no way to conform gender queerly. Does that make sense? This isn't to say that one way is better or easier than the other. Being stealth, being presumed to be cisgender by the people around you is not a, a better position to be in necessarily. There are also dangers that go along with that. For example, the trans panic defense. There are a number of states in the United States right now where it is still legal to defend yourself against a charge of murder by saying that finding out a person was trans scared you enough that you killed them. This is, it's not an oppression Olympics thing we're doing here, but there are different experiences of social dysphoria depending on how a person experiences their gender and whether or not it is possible to conform to stereotypes of one's gender or not. Okay, next up, and building off of, we have societal dysphoria. So social dysphoria is what gender do other people think I am? Societal dysphoria is, okay, what is expected of me based on what gender you think I am? So this has a lot to do with relationships and sexuality, and not entirely, right? Things like clothes, names, and demeanor and personality are also wrapped up in this. But I think that queer cisgender people are perhaps the most likely to be able to empathize with and maybe even experience societal dysphoria a little bit because so much of gender stereotypes are wrapped up in how we are expected to perform our sexuality and relationships. Get married, have babies, etc. Um, so this study here in the International Court of Environmental Research and Public Health was a review of 33 other studies, and they found that mental health disparities in transgender youth were mainly attributable to societal gender pressure to conform to their assigned gender, which basically comes down to if we just let transgender children be who they need to be, their mental health outcomes improve. This can show up in really confusing ways when we are still learning our social gender roles. So there's this there's this myth, this narrative about socialization where we talk about how what gender a child was raised as. And the assumption tends to be that a child will just believe people when they are told they are the gender people expect them to be and automatically absorb all of the messaging for that gender. And from personal experience, I can say that that is not really the case. It is possible that, for example, a trans girl grows up as a boy, believes she is a boy, and tries really hard to live as a boy, and only takes in messaging about boys in her socialization. I suppose that is possible. And for trans boys as well, entirely possible to grow up as a girl, believe that person believe themselves to be a girl, and only take in the messaging about what it means to be a girl in the world. But I do not think that is common, and I especially don't think it's very likely. Um, I can only talk about my own experience, but for example, I have a really, really clear memory of when I was young. I think I was maybe 10 or 11 years old. Um, so I was like just starting puberty, or maybe a year or two in. And I was sitting in a classroom with a friend of mine, and she said something to like make fun of me. And I just kind of like smacked her on the shoulder, my hand. And she was really shocked and was just like, you can't just hit people when they upset you. Which obviously it was a great lesson for me to get that day. You can't just hit people because they upset you. It's obviously not good to do that. But I was really confused because I had internalized social messaging about how to interact with other people based on watching boys play, and didn't, even though I didn't realize I was trans, as far as I can remember, never thought about myself as a boy consciously. I had clearly internalized the kind of the messaging about what was appropriate for play as if I was a boy. And I'm very confident that if I had been a boy and if my friend had been a boy, that my friend would not have said anything and no one else would have cared. And I would have just continued to go on acting that way because it was seen as an acceptable way for boys to act. All of which is to say, I do not think most trans people take in coherent messaging about gender roles just for the gender that other people tell us we are. I think it is generally much more. Okay. Next up, presentational dysphoria. So again, social is what gender do people think I am. Societal is what do people expect of me because of that. Presentational dysphoria is like, what is my relationship to what people expect from me? So we're talking about how a person presents themselves in relationship to stereotypical expectations. There's this another common anti-trans narrative that trans people are just conforming to or replicating gender stereotypes, right? Like girls wear dresses and boys get muddy and play with trucks, and girls like dolls, and boys are good at math, and all of these ridiculous things. Um, the science on this, though, is actually really, really interesting. Is if we ask the question, do trans people conform to stereotypes? The answer is sure. Of course, many trans people conform to gender stereotypes. Specifically, pretty much exactly the same percentage of trans people conform to stereotypes as do cis people. So this study here from 2019 in the Proceedings of the National Academy of Sciences looked at 317 socially transitioned transgender children between the ages 3 and 12. And they found that they did show a strong preference for clothing, toys, or appearances that aligned with their affirmed gender identity and the stereotypes associating with it. But more importantly, they found that that preference matched patterns seen in cisgender children of the same gender. Transgender children are just as likely to conform to gender stereotypes as cisgender children. In other words, a transgender girl is just as likely to be a tomboy as a cisgender girl. And a transgender boy is just as likely to be effeminate as a cisgender boy. Another thing that I often hear from anti-trans people is this: when arguing that trans people, we should just appreciate our sex, whatever. They've been asked, well, why couldn't you just be a masculine woman? And the answer is that because I am neither of those things. I am not mask. I am not butch. I wear comfortable clothes. I certainly don't perform high femme by any stretch of the imagination. But I am very much an effeminate masculine person, not a masculine woman. My body works better with testosterone. My brain works better when I don't have to think about having a chest that didn't make any sense to me. But I still love wearing makeup and dresses and doing femme stuff. I am absolutely not just a guy, not a Hank Hill type like these dudes over here. Um, yeah, trans people being masc or femme or somewhere in the middle or all of it all at once, those things are related to gender, but they are not themselves gender. All right. Very, very briefly before we talk about transitioning, I want to talk a little bit about sexual dysphoria. There is this persistent myth of uh, transgender people transitioning as a fetish of some kind. Personally, I think this probably comes out of the fact that trans people are hypersexualized as a result of our prevalence in the sex industry, because trans people are so much less likely to have access to wealth, because trans people are much more likely to be kicked out of their homes when they're young, to not have opportunities like going to college or university, to have a much more difficult time in the job market. Um, Trans people are more likely to do sex work. Uh, I do not think it is a coincidence that there is a higher dominance of the consumption of transgender pornography in states that are more critical of and restrictive of trans people. We tend to be seen as sexual objects rather than human beings with agency. Advocates of conversion therapy like to bring up sexuality as a way to paint transness as this fetish, some kind of kink, but and they will use stories about improved sex life or body integrity as a way to prove that. But I think the most simple explanation here is that feeling good in your body feels good. If you cannot stand the physical sensation of your sexed body, if you can't even look at your body in the mirror because it makes all of the alarm bells in your brain go off, if all of your potential sexual partners see you as a different sex or gender than the one your brain tells you you are, or the one you know yourself to be, that is going to make it very difficult to have a fulfilling intimacy or sex life of any kind. We have plenty of studies that show that quality of life for people who experience gender dysphoria uh, is improved by transition care, that people who transition have more satisfaction with their body and less sexual distress. But that doesn't mean that it is a fetish to be trans. It just means that feeling good feels good. It is a lot easier to feel good in your body in a sexual way when you feel good in your body in all of the other ways that we've talked about. All right, transition. We're just going to run through this real quick here. So when I talk about social transition, I'm talking about non-medical gender affirming care. So things like changing your name, changing your gender marker on your identity, using different pronouns, growing your hair out or getting a different haircut, wearing different clothes, clothes associated with the gender you want people to see you as, wearing makeup, or, and that goes for trans femme and trans masc people. You can do certain types of makeup that make your face look more masculine, for example. Um, this is the kind of transition stuff that can happen at any time. In general, for young people, especially prepubescent children, the only transition that they are accessing is a social transition. You do not need a doctor for this. If your child wants to try out different pronouns and use a new name, you can just let them do that. If your kid wants to start shopping in a different section of the store, they can just do that. That's fine and normal. Something that I do find interesting is that while young people are generally doing a social transition before anything else, a lot of adult trans people start a medical transition long before they socially transition. I think that has a lot to do with how we are read by other people. Socially transitioning when your body is still read as the gender you were assigned at birth can be more dangerous. But for a prepubescent child, there is no secondary sex characteristics that are going to be read as one gender or another, and so social transition is often very successful. All right, medical transition. So here we're talking mostly about hormones and surgery. Surgery isn't for everyone, but it is life-saving. So every surgery comes with risks, recovery time, costs, and so not all trans people want surgery. And of the trans people who do want surgery, many can't afford to access it. It would be wonderful if that changed. Right now, it seems like that's getting a lot worse. Hormones are fascinating. So I really want to talk a little bit about what hormones do in the body because they impact virtually every physical body process. This image on the right here is of the hand of Jocelyn Bashley, the author of the Gender Dysphoria Bible. This one before she started transition, and this, I think, 5 years after. Hormones impact fat distribution, muscle mass, uh, so the body proportions, the cheeks and the jawline. They impact skin texture and tone, size and shape of the connective tissue, which is what causes the slimming of the hands here. Impacts facial hair, body hair, voice pitch and resonance, breath development, skeletal build. So that includes the range of height, size, and feet of hands, the width of the shoulders, the rib cage breadth, the thickness and density of the limbs, the forehead, the brow, cheek and jawbones, and pelvic width. Now, a few of those things I mentioned are one way, as I said earlier, but most of these things can change with hormones. So, for example, uh, when a transgender woman starts taking estrogen, as her musculature atrophies, ligament flexibility increases, weight shifts lower on the body, and the orientation of the pelvic bone in relation to the spine and femurs rotates forward by about 10 or 20 degrees. This causes a change in the alignment of the spine and the hips, which increases the arch of the back, and this can cause a relative drop in total height of between 1 and 2 inches, which is significant. Medical transition can completely change a person's appearance. Uh, and as I mentioned, while medical transition gender affirming surgeries are generally elective, not emergency surgeries. They are not cosmetic surgeries. Not all plastic surgery is cosmetic surgery. That's an important distinction. Okay. Starting to wrap up here, I want to just briefly talk about regret and detransition. All medical treatments have regret rates. Gender affirming transition care has significantly lower regret rates than any other type of medical procedure. Most people, this review here, systematic review and meta-analysis, looked at 27 studies, which pooled almost 8,000 transgender patients who underwent any type of gender-affirming surgery. The regret after gender-affirming surgery was 1%, 77 people out of this whole group. Most of those people did not regret their transition because they were not trans, but rather because of an adverse side effect, a surgical complication, or experiences of discrimination or alienation. So as a bit of a comparison, a pretty standard regret rate for surgical intervention is around 10%. For riskier surgeries like knee replacement or spinal surgery, it's often higher than that. An appendectomy, so surgery to remove the appendix of a person whose appendix will explode if it isn't removed, is 10%. 1 in 10 people who have their appendix removed regret it, even though it could kill them if they hadn't had the surgery. Bariatric surgery also has a pretty high regret rate. Breast augmentation, rhinoplasty, liposuction all have at least a 10% regret rate in general. Having children has a 7% regret rate. Getting tattoos has a 15% regret rate. Gender affirming surgery has a lower regret rate than winning a large sum of money in the lottery. I'll just leave you with that. Detransition rates tend to be higher than regret rates. People, in this study here, we found the study examines a little over 27,715 transgender adults in total, and found that 13% of people had some history of detransition. 82.5% of those detransitions were driven by at least one external factor: pressure from parents, social stigma and discrimination, employment difficulties, a loss of insurance coverage or an inability to afford care, being in a non-affirming environment like a school or with a partner or family members, counselors, clergy, or therapists, an increased vulnerability to violence or sexual assault. Only 16% of the 13% of people who reported a history of detransition reported one or more internal factors. So a fluctuation of gender identity or doubt about gender identity. So in other words, 1/3 of 1% of the 27,000 people surveyed actually questioned if they were trans and transition was right for them or not. 1/3 of 1%. Okay. And last, I would like to point out that cis people also experience gender dysphoria. We all have experience of gender, even for agender people whose experience is, oops, no gender. This means that cisgender people also sometimes experience distress because their body doesn't match the way that they expect to for their sex or their social experience or something else. So, a few examples, people who have breast cancer and have to get their breasts removed. It is well documented that a mastectomy for cancer in cisgender women can cause extreme mental distress. And this is why reconstructive surgery after a mastectomy is considered part of the care. Hormonal conditions like gynecomastia and PCOS can cause dysphoria. So this image here you can see is a cisgender man who grew breasts because of hormonal condition. In this image, he has been shaved to prep for surgery, and this is what he looked like after surgery. Of note, the vast majority of uh, insurance covered surgical treatments for young people in the United States, specifically in the mastectomy category, are cisgender boys who develop breasts and need to have that rectified. Cis people also experience social dysphoria. So this is Amanda Bynes. She was in this movie, She's the Man. Is that what it's called? Yeah. And also there was a recent story about Maisie Williams, who played Arya Stark in Game of Thrones. And both of them have spoken about the mental health distress that they experience seeing themselves portrayed as boys on the screen and having to dress up as to present as a boy for films and how for television, Williams, and how that impacted their mental health in a really difficult way. Right. I'm going to put links in the description here for these exercises. Um, so you can try them at your leisure in your own home. You don't have to sit through me talking you through them all. But before that, and before we sign off, there are just a few things that I want to say about the exercises and the content today. So, first of all, if you are trans, you do not have to do these exercises. That's absolutely not necessary. Um, if you sat through this discussion about dysphoria and you found yourself thinking, wait, doesn't everyone feel that way? Um, I want to be the first one to tell you that no, everyone doesn't feel that way, and you don't have to feel that way either. You can proceed with these exercises if you are supported. If you have a support system, you have people you can talk to about what comes of these experiences, then please enjoy them. Uh, if you are sure, if you're sure that your gender is the one that people have always told you that you are, I really encourage you to check out some of these exercises and just really try to immerse yourself in the scenes and the questions, um, and see what empathy and other ideas it brings up for you. And if you're curious about your gender, if you aren't sure, then do try them, because countless trans people before you have learned something new about themselves. Okay, signing off. What can you do? first and foremost, I would really like you to show up for the trans people in your lives, in your world. Believe us, use our correct names and pronouns. Practice using them when we aren't around instead of just apologizing when you get it wrong every time. And ask how you can help. Um, Contact your representatives about anti-trans legislation. Support trans-led organizations. Advocate for trans inclusion. I particularly, uh, there are some particular resources I'll recommend on the next page that you should check out. And challenge misinformation. I say this, I do not mean in the comments on some Facebook post that is full of transphobes. Arguing with bots on the internet is not going to change people's minds. I want you to talk to your friends and your neighbors and the people who go to the same church as you, or the people who go to the same yoga class as you. Talk to the people in your life. Counter harmful narratives about us in the media. Follow trans journalists and creators. Watch trans media. Read trans books. And if you have trans people in your life and you are still struggling with knowledge or feelings, find your local PFLAG chapter and get support. Right. Resources. As I mentioned, the Gender Dysphoria Bible is incredible. Please check it out. If you got something from this presentation and you want to give Jocelyn some props and some cash for her hard work, if you go to her website, this little coffee cup icon up the top here will take you to her Buy Me a Coffee page, and you can send her a bit of cash. Transgender Map has a lot of information about different trans goings on, resources for all sorts of different people, trans people, questioning people, allies, and anyone who's just looking for a little more information. It's not on here, but I also recommend translegislation.com to track trans legislation. And as well, you can check out Erin in the Morning. Her reporting is excellent. If you're looking for queer trans books, I highly recommend the Queer Liberation Library, which uses Libby, I think. And this, of course, is me at Wellbeings News. So if you want to learn more about queer trans health, especially if you are a health or wellness professional, or if someone in your life is, please check this out and say hello, sign up for the newsletter, and you'll receive notification when more videos like this get posted. Thank you so much for spending your time learning with me today. I'm really glad I was able to re-record this and get this out to more people after the presentation at the Oaxaca Lending Library. So thank you for sticking around and hearing me out. And I look forward to seeing you again on our next presentation. All right.